So welcome everyone. This is our chapter on COVID-19, which is a very interesting chapter, and it's very important to me because that was the kickstart of getting into this topic. And so I got very interested. I always had a bit of interest in within infectious diseases in general. But they were very far from my, background, aside of the fact that I'm a statistician. But, I'm specialized in actuarial sciences, so not in infectious diseases or epidemiology or so biology, those things. But, when these outbreaks arising, I got very interested in playing with these growing numbers. And so this chapter is a bit like a summary of what is COVID-19 in itself, that it was an unknown type of infection that then, with the huge effort of all around the world, it was a huge call for everyone to find an explanation about this unknown virus. That was a very good intervention, world intervention. And so now it's a very well known, at least, even if we have a lot of data, but within a short term time. So we don't have this repeated within many years, such as other infectious diseases. But we can say that we know enough about this virus up to now. And so here, what I did, and this is just for you to visualize what's happening within these two last chapters. There is an epidemiology section with some explanation, overview of the disease, of the virus, and the same is it's provided for the case of malaria. And then there are a couple of examples. One in particular for modeling the spread of infectious diseases, and then what happened with the DALIs, basically. And so this virus that we all know now, it's believed to be to have zoonotic origins, and that means that there has been a spillover. That means that the virus came from a host which was not human but animal, and jumping into a human. So that are the type of virus that are called zoonotic. So the zoonoses are fascinating spillovers, because as my vet said, because I have a dog, I have a Jack Russell, no? And I always talk with my vet, and because I'm curious about those things, and I like to learn about what are the differences between humans and, for example, these dogs, And he always said to me, "Don't worry, the virus, so anything that the dogs has won't get into you. So you won't get any of the things," because I said, my dog is going to sneak around and things, and then jump in my bed. So is that dangerous? And he always said, "No, don't worry, there is no danger, because the virus that gets into your dog doesn't get into you. So they are completely separate things." So that is something to think about. That it's just a fascinating topic. But then on the other side, there are these cases of called zoonosis. And these are the cases when a virus can pass from an animal and get into a human. Okay, so what are these animals? Mostly mammals. You know, if you can think for, so like these bats, fruit bats, and then in the case of COVID-19, they were talking about these pangolins that were like very, and I see they were like ancient type of animals. And so they got a virus, and this virus passed to us. And so how do you, this is something that you might want to think about. How would you prevent this type of viruses to spread within the humans, the human population? So you will need to save the animals from this virus. And so the same as is for malaria. Okay, malaria is the same thing. So here I've just given an overview of this type of viruses that comes from animals and then are able to get into human. I'm also very interested in rabies, which, as I said, even within a conversation with my vet, he said, no worries, you don't have to worry about rabies within your dog, because it's something that it doesn't happen. If it's happening, it's a very important concern for the local population. So all dogs will be alarmed, all dogs will be vaccinated. Instead, I see, on my opinion, that there might be some spillovers as well within this rabies virus. But it's still, you know, within just some thoughts and some very early research that are not enough for us to draw important conclusions. So everyone got involved with this virus, World Health Organization, the United Nations, all the local civil protections, arms and things. They were all looking forward to find a solution within this virus. And worldwide, we all had different type of healthy measures to prevent and contain this virus. So we all know about that. So what happened with this, that was a new virus, so nothing new, nothing known. They had to find a test that was able to identify the spread of this virus, and then treatment, and that was a very competitive rush run to provide a vaccine for the population. That was nice as well. So here I've what we saw in the previous chapter was what was a SEER model, or SEER-I model, and that is the type of model that we use to simulate, okay, the infections. But then, so this is something that I would like to clarify. What's happened when you do infectious diseases modeling, that you don't, so this SEER model or this exposed, infected, recovered model is not enough for you to be able to build a model that is that has the features to be able to forecast, so predict future happenings. So you will need that to simulate the spread, but then you will need something else, such as Bayesian machine learning approach to predict to be able to use the simulated spread within the future and see how it could be. And so the combination of these two is the key for modeling COVID-19, for example, such as here. What I did is again exposed, infected, and successful exposed, infected, and recovered model, just as the same as we know, with differential equation. And what's happening here, that the results are that we have a simulation, okay? We have a vector, we have built a vector with simulated number of infection, and these are simulated based on some parameters. And these parameters are the parameters that we have been able to estimate, and that we can say that in this case, we are doing deterministic modeling, because we define what are the level of these parameters. So the population, the transmission rate, or the infection rate, okay? So the beta, the recovery rate, and the incubation period. So to simplify, as I mentioned, the transmission rate or the infection rate is 1 divided the number of people that get infected. The recovery rate is 1 divided the number of days that takes to recover, just to simplify, okay, for you to visualize the things. And these are the number of days. This is not in an inverse proportion, but it is just the number of days that we define it as to be 5 days incubation period for COVID-19. So having defined these things can influence the result of your simulation a lot. So those are very important. And then we draw our well-known plot with, and we are interested in this green line, which are the infected. Okay. But now we need to see the future. Okay. So we want to get this infection vector and see what is going to be in the future. Okay. We imagine, we assume that it should have a normal distribution, in the meaning that it goes up, reach a peak, and then it goes down. Okay. So for now, we assume that this is normal distributed, which is not necessarily for, so it can be a beta. Okay. So for now, we assume that this is normal distributed with some parameters. Okay. Our beta and our gamma. Beta in this case is both the estimation of the coefficients and the infection rate or the transmission rate, and gamma is the recovery rate. Okay, so this is our starting point. We do a bit of data manipulation to have this type of data. We have the date of the day of the week of the year, the months, and then we set these two last vectors with the lag of cases. Lag means that I go forward of 1 day, I go forward of 7 days. Okay. And we use some Markov chain Monte Carlo simulation algorithm. What this means that we provide samples of our data to use within our model. And to have more data, and simulate different happenings, draw it within our data. Okay, so we simulate those things. And we use this BRMS package, which I love that very much. And it is very useful. It is amazing, useful, because it embeds STAN. So if you want to have, I don't know what are your knowledge on this topic, you can see at this address, put in the chat. Okay, so this is STAN. This is a language, okay, with that it cannot be directly used in R. So you need an interface, something that would allow you to use STAN. Nothing better. See, there are other tools, but I like this one because it makes the things clearer and you can use R. So you're using STAN, but within a R visual type of syntaxes. And so this function is a Bayesian regression model function and allows you to set the model function, set a family. Okay, it is not difficult. If you have a quick look at the STAN documentation, you can see that this is gets into probability theory. And what's going to happen is that you have this bell curve of the infected. And so you set this to have a Gaussian family. And then you set some priors. The priors, okay, in probability theory, this is out of the scope of this book. So and it is a topic, very important and everything. So you have a starting point with is your data or your simulated data and everything, or your estimated data. And then you are predicting the future. So you need to have some fixed point, fixed step to such as to build up upon your model upon. Okay, and those are the priors and the likelihood. Okay, the priors are the type of such as the Gaussian, such as the family that you define here, are other family of data distributions that you suppose are replicating the your data. Okay, so you set the prior to be normal, and the fact that you set the prior to be normal and another prior to be a Cauchy means that your data will be a combination of these two type of distributions. Okay, and these are parameters, not deterministic, because you then they will change within each iteration. And here we have the number of iteration, the warm up, because it's as well, and the number of nodes that each iteration will get into it. And this is like such as a code number to allow the reproducibility of the result. And so now I don't have much time, but seeing that we meet each other next week, I will suggest you because I will go forward with this, to have a look at the documentation a bit, both STAN and the BRMS package, that just the very introduction of these two will allow you to have a greater focus on those particular arguments that we will go back into that next week. And so this way we build a Bayesian model, a model that include that will release a posterior sample. So what we do is we provide a formula, set a family, and then we decide for the prior. So we say this distribution will start to be having these shapes, but then I don't know what it's going to be. So I suppose it's Gaussian. Let's shuffle all the data and try some different type of level of the parameters and release me an output. The output is our posterior sample. And then we will see how it looks like and what it's going to be. Yeah. So I look forward to see you next week.